Let's move on to the precordial examination. We start the precordial examination by looking for the apical pulse. Sometimes the apical pulsation may be visible. Look for any parasternal pulsations and the pulsations in the second intercostal space. Pulsations in the second intercostal space indicate the presence of pulmonary hypertension. Try and locate the apex by palpation. First by using the whole hand and then by trying to locate it. It's very important that you localize the apex. You localize the apex by counting the rib spaces. The second space starts at the angle of Louis and then you start counting downwards and laterally. Second, third, fourth and fifth intercostal space. And also you localize the lateral location of the apex by drawing the mid-clavicular line. Mid-clavicular line is a line drawn from the midpoint between the acromion and the suprasternal notch. You describe the apex in relation to the rib space as well as to the mid-clavicular line. Once you locate the apex, it is important to describe the character as well. Character could be normal apex, tapping apex in case of mitral stenosis, or whether it is heaving. And the heaving could be a sustained heave indicating pressure overload, or non-sustained thrusting apex indicating the volume overload. Examination of the character of the apex gives you a lot of valuable information.
Left parasternal heave is a sign of right ventricular hypertrophy. There are several ways of checking for the parasternal heave. One is to keep the fingers in the intercostal spaces like this, and the other way is to keep the ulnar border of the hand firmly against the left sternal border. In case of severe pulmonary hypertension, one might even feel the closure of the pulmonary valve in the second intercostal space. This coincides with a loud pulmonary second sound.
The last component of the cardiovascular examination is auscultation. You start auscultating by using the bell and auscultating over the mitral area, over the apex. Then you ask the patient to turn to the left lateral side and auscultate over the same area. That's RFP method. Then you use the diaphragm and again auscultate over the apex and along the left sternal edge. Tricuspid area, second intercostal space on the left side, pulmonary area, and on the right, the aortic area. You have to auscultate the whole precordium as well. When you auscultate, first you concentrate on the heart sounds, first and second sounds, and ask yourself whether they are normal or abnormal. Are they of normal intensity? Are they louder than normal? Or are they softer than normal? Then you concentrate on additional sounds, third, fourth heart sounds, and any clicks. Then if there are any murmurs, you concentrate on the murmurs and try and ask yourself whether the murmur is systolic murmur or a diastolic murmur. It's very important that you time the murmur. To time the murmur, you should have your thumb over the carotid while auscultating. First you concentrate on the systole and diastole and see whether the murmur you hear is a systolic murmur or a diastolic murmur. If it is a systolic murmur, ask yourself whether it's a pansystolic murmur or an ejection systolic murmur. In case of diastolic murmurs, you should find out whether they are an early diastolic murmur or mid-diastolic murmur. If you hear a murmur, for example, if you hear a murmur in the mitral area, you should check whether it radiates to the axilla. If you hear any murmurs in the base of the heart, that is, the upper part of the sternal edge, you should see whether they radiate into the carotid. You complete the auscultation over the base of the heart by listening in the seated position. Sarath පොඩ්ඩක් වාඩි වෙන්න. හොඳට හුස්මක් අරගෙන එළියට දාලා අල්ලගන්න. හුස්මක් එළියට දාන්න. ඔහොම අල්ලගෙන නවත්තගෙන ඉන්න. In this position, during expiration, you listen for the early diastolic murmur of the aortic regurgitation. Lastly, with the bell of the stethoscope, you listen over the carotid for breath. At the end of the clinical examination of the cardiovascular system, you should be ready with answers to few questions. First question is there a cardiac lesion, and if so, what is the lesion? Then, whether the patient is in sinus rhythm or not. And thirdly, whether there is any evidence of heart failure. To find the answer to the last question, you have to listen to the lung bases and also examine